Hello everyone, welcome back to our Nutrition and Dietetics lecture series. Today we will be discussing clinical assessment of nutritional disorders. It is an essential topic for understanding how nutritional deficiencies can be identified through physical examination. What is clinical assessment? It is a simple and widely used method to identify nutritional deficiencies. How can we identify? By observing physical signs and symptoms present in the body. It is commonly used in community nutrition surveys. Why? It is very inexpensive, quick, and help to detect malnutrition at an early stage. Clinical examinations can be only done by a trained personnel. It is a must and should be in under proper lighting condition. Standardization is important to ensure that different examiners identify signs consistently. That means repeated observation of same sign. During assessment, record only the presence or absence of sign and avoid grading. That means plus or minus, not double plus or double minus like that. A well prepared performer helps to ensure that no nutrition deficiency sign is overlooked. We can identify several nutritional disorders by clinical examination. For example, protein energy malnutrition, vitamin A deficiency, anemia, goiter, vitamin B complex deficiencies, vitamin C deficiency, rickets, essential fatty acid deficiency, and fluorosis also. So each disorder presents with a certain characteristic clinical signs. First of all, we are going to discuss about protein energy malnutrition. It is one of the most important nutritional problems affecting among children. There are three major clinical forms for PM, that is Kwashiorkor, marasmus, and marasmic Kwashiorkor. These conditions are result from inadequate intake of protein energy or both. So Kwashiorkor is a form of PM. It commonly affects among children aged between 1 and 3 years. The hallmark sign of kwashiorkor is edema or swelling, especially in the legs and feet. Other features include the child should be in an irritable condition. Child shows irritability, and he should be in apathic condition. And there is seen skin changes like a peeling of skin or hypopigmentations like that. And there are also seen hair discoloration. It is known as the flag sign and also increased susceptibility to infection and immunity is very low. This picture shows the Kwashiorkor child. Next is marasmus. It is characterized by a severe wasting due to prolonged deficiency of both calories and protein. The child appears extremely thin with loss of muscle and body fat, loose skin, sparse hair, and old man-like appearance. We say in Malayalam like illum tholum. So, in this case, marasmic children, frequent infections and diarrheas are also common. The main point is edema is absent in this case. Marasmic Kwashiorkor is a combination of both marasmus and Kwashiorkor. The child shows severe wasting of muscles and along with edema. It is considered one of the most severe forms of malnutrition. And this type of children we have a difficulty to identify um, by clinical examination as have a PEM. Next, we enter into vitamin A deficiency diseases. Vitamin A deficiency is a progressive disease condition. It primarily affects the eyes and is collectively known as xerophthalmia. The condition progresses from night blindness to conjunctival and corneal changes, and if untreated, it may lead to permanent blindness. Beginning, the eyes affected as a night blindness. It is the earliest symptom of vitamin A deficiency. It affected children have difficulty seeing in dim light or at dusk. So parents may notice that child struggles to locate food toys or objects in a poorly lighted environments. If it is untreated, it entering into conditions like conjunctival cirrhosis. It refers to the dryness of the conjunctiva. It shows in the picture white portion of eyes is become dry. Normally smooth and shiny surface become dry, rough and thickened and wrinkled. It shows clearly seen in the picture. This is an early visible sign of vitamin A deficiency. So if it is untreated, it enter into the conditions white or spots. These are characteristic signs of vitamin A deficiency. They appear as a white, foamy, raised patches on the conjunctiva, usually near the outer side of the cornea. These spots may occur in one or both eyes. This is clearly seen in this picture. So, vitamin A deficiency become progress, corneal ulcers may develop. These ulcers can deepen and lead to perforation. Keratomelicious is a severe condition where the cornea softens and breaks down rapidly, often resulting in irreversible blindness. So, in this stage, the deficiency affects the cornea. Corneal scar means if the corneal ulcer is healing, a white scar may remain in the cornea. Depending on size and location, the scar can significantly affect vision and may cause permanent visual impairment. This picture shows a white in the center of cornea.